Cool. Tourniquets made from random junk, blood loss in the middle of the jungle, and improvised medical kits that are definitely questionable. Today, we're reacting to the healing animations and survival medicine from the tactical military shooter game Zone Warfare. Let's dive right in. Cool. Auto injectors, preloaded syringe on the inside. Sometimes these are single use versus multiple use, meaning the epinephrine that we have for an EpiPen is a one-time dose versus an insulin pen, multiple different amounts of medicine in there so they can give it to themselves multiple times. In the game, you're getting shot in your forearm. Most of the time when you're giving these type of injections, you're either going sub-Q or IM, you're not going intravenously. Say you're diabetic and you need insulin, a lot of times you're doing subcutaneous on an angle of the abdominal wall into that tissue. Could be pain medication, could be stimulants, energy boosts like epinephrine. It also could be related to wound healing. We have like peptides nowadays out there, maybe something similar to that. Really cool concept and actually really nice graphics. Oh, cool. All right, we got some splints. Actually, that is so good. Those look like the brands I see when patients come in from EMS. They can be molded, either have a wrist injury or a forearm injury, unlikely elbow. When somebody comes to the hospital, if the EMS put them on well, we'll actually leave them in place. We'll just double check to make sure the patient has sensation distally and a good pulse. Oh, we got a tourniquet going on. Trying to save somebody's life by slowing down all the bleeding. That's the whole point. At the antecubital fossa, basically in the elbow. Maybe necessary, maybe not. You could probably just use the bandage. Different types of tourniquets. Very cool.
Very cool stuff.
There's a mechanism to where you can actually twist it to get it even tighter. You want to actually document when you put it on so we know how long it's been on there. If you have to leave it on for days, you know that the distal end of this tourniquet is going to die. But if you're trying to save somebody's life, that's a different story. Yeah, so this third tourniquet is the one that I actually carry around in my car, called a CAT, a combat application tourniquet. It has a really nice bar that actually you spin, and it does hurt a lot when somebody puts it on really, really tight, but you're actually confirming that it's working.
That means it's working.
Oh, we got a bag. I have many of these type of kits in my house. We have tweezers, we have some either scissors or Kelly clamps, and then another device that's probably for either gauze or a blade. All right, so these are another clamps here. It looks like you just pulled a bullet out. Typically, it's not life-saving to remove a bullet. If it's in your brain, if it's in your spinal cord, if it's in a joint, maybe. But majority of the time, it's in soft tissue, it's broke through bone. In my experience, majority of the time, the bullet stays in. Oh, very cool. That is a big curved suture needle, which actually we use. The reason why you have such a big arc like that, looks like a crescent moon, you want to go under and then come back out. You don't want to go straight across. You don't want to pull. This is much more anatomically easy. You just turn the wrist.
It's all in the wrist.
Usually bullet wounds or puncture wounds like this, we don't sew up. So because it's a penetrating trauma, you're pushing pathogens deep into the tissue. And so if you do sew it shut, you now are potentially locking in bacteria or viruses or whatever else is out there into the wound. Oh, we have a blister pack here, getting some medications. Majority of the time, it could be related to pain meds, it could be related to antibiotics, it could be related to radiation exposure, because sometimes you need potassium iodine pills. Most common pink medication I've ever seen, Benadryl, diphenhydramine. Then you'd say amoxicillin has a little bit of pink in it, but I think it's like pink and purple or pink and blue. And then Pepto-Bismol is pink. Those are the pink ones that I know of.
It's pink.
No, it's psychedelic, mate.
It's pink.
These pills most commonly look to me like the classic acetaminophen that you would get at the hospital. Bottles of medication are good, just checking to make sure that the medicine hasn't expired. It's what the manufacturer puts on. Typically it's about 2 years. Sometimes when you get your meds from the pharmacist and they put it in a new bottle for you, they shorten that because it's not in its original sealed container. taking the meds without any liquids.
You ever like try to swallow a really big vitamin with no water?
You can actually get pill esophagitis when the pill actually gets stuck in the esophagus and causes inflammation, potential erosion, and significant amount of discomfort to that tissue. Can cause massive issues. So please don't do that. Make sure you lubricate before, during, and after. Oh, we have an IV kit. This looks like a blood bag. You see the red behind and it's got an IV. So, oh my gosh. So we got good blood vessels to access intravenously, but you can't just stab it that easy. It takes a lot of skill. As an ER doctor, we are not the best at getting IVs. It is the nursing staff that is very good. Putting in an IV, you need to clean the area. You might actually use a tourniquet. At the hospital, you'll see that most IVs are put on a pump, except for like normal saline. Then we just throw that wide open or just trickle it in. But most of the medications and blood need to be going in at a certain rate. Some of these combat wound survival scenarios reminds me in emergency medicine, staying calm can genuinely make a difference. One of the reasons I created Chillax by my company Life Happens, designed to help keep racing thoughts from taking over. Whether you're trying to survive a tactical mission or just dealing with real world stress, check out Chillax at lifehappens.com or on Amazon. Looks like auto-injecting through clothes, which you can do. We say that all the time for people who have anaphylactic reaction requiring the EpiPen or other brand. Gets a knife out, oh, and then splints the arm, which is great. Good job. Again, that's just for either forearm bandaging or for wrist injury. Oh, and the lasso. Let's add another tourniquet to another tourniquet. We're going really proximal with the tourniquets. You don't necessarily have to go that proximal. If the injury or what you're dealing with is below the elbow, you can go just above the elbow. You wouldn't be suturing through your clothes. You'd have to take your shirt off so you can actually see that. Hopefully you would clean the wound, use antiseptic, use anesthesia, and then bandage it up afterwards. It's interesting that they have blood in their pack. So typically blood needs to be kept at a certain temperature. Once it's actually been thawed to room temperature, it has an expiration. Just like, you know, anything else that you would put in room temperature. Just rips out the IV and he's fine. Patients do this all the time. They rip out their IV and now they're just bleeding everywhere. There's a big hole in there. So your body needs time to close it up and you need to put pressure on that area. What kind of food we got? We got food? Oh, we have like an MRE. Mr. E. Meals ready to eat. I've never had one actually. What is your favorite one and what is your worst one? All I've heard is that they're gross and they cause constipation. This is amazing. This is so cool. It's probably one of the cooler graphic games relating to like medical healing animations. I really enjoyed that. If you guys enjoyed this react and want to see other cool videos that I've done, definitely check out this playlist right here. Binge watch it all. As always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching and stay healthy, my friends.